Good afternoon, everybody. I'm Sanchika, your host for today's live from All About Skin Allergy team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some time in their lives. Urticaria is characterized by a round rash on the skin that itches intensely. It may be due to the chemicals present in certain food items, allergy to certain medication, insect stings, sunlight, and sometimes the cause is even unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the populations do suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age groups. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self medication can worsen your symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its management. So today we have with us renowned dermatologist Dr. Sanchita Gupta live from the Skin House and Sarvodaya Hospital, Faridabad, who will educate us more about urticaria and its management. Dr. Sanchita Gupta is a dermatologist and has an experience of 10 plus years in this field. She completed her MBBS from Manipal Academy of Higher Education, Manipal, India in 2013 and MD Dermatology, Venereology and Leprosy from MJP Rohilkhand University in 2016. Dr. Gupta is a dermatologist. The Skin House is a spacious dermatology skin clinic in Faridabad. She's a member of Indian Association of Dermatologists, Venereologists, and Leprologists, IATVL. Some of the services provided by the doctor are skin biopsy, skin rash treatment, atopic dermatitis treatment, skin checks, and laser therapy. A very warm welcome to you, Dr. Sanchita Gupta. Hope you're doing good.
Thank you so much. Hope you're doing very good as well.
Yes, absolutely fine. Thank you so very much. Doctor, today we are going to talk about urticaria and its management. But before that, we would like to understand what urticaria is.
So, urticaria is basically an allergic reaction to allergens, which usually presents with itchy rashes on skin. So, there is sudden onset of red raised bumps. They are of variable sizes and variable shapes, and they can appear anywhere on the body. These rashes, these usually last for few minutes to few hours, and then they settle down only to reappear later on somewhere else.
Okay. So it's an allergic reaction basically. And you have already told us, that how it looks. It's bumpy, it's red in color, but still because skin rashes or other allergies are equally very common. If we would like to, understand how does an urticaria or hives looks like?
So these are usually raised rashes, red in color or pale red in color, something like a mosquito bite or an ant bite. So what distinguishes it from the other skin rashes is basically it appears and then it settles down and then reappears. And there is also one more thing that we can do. These rashes are blanchable. That is, when we give pressure onto these urticarial rash, they become pale or white in color. So that distinguishes it from other rashes. So
Okay,
all
so
these
now it
features, they make it, urticaria very characteristic rash.
Exactly. So now at least we know how it looks like. You also said that it's an allergic reaction, and allergies are definitely one of the causes that are responsible for urticaria. But along with that, are there other causes that are responsible for urticaria?
There are many causes which can trigger urticaria. Certain food items, certain medicines, certain allergens in the environment, then certain infections or some physical stimuli. For example, in food, certain these seafoods or nuts or milk, eggs, or foods with preservatives, berries, all these things can trigger urticaria. In medications, NSAIDs, aspirin, ibuprofen, or antibiotics can also trigger or exacerbate signs of urticaria. Allergens in environment like pollen grains, pet danders, then house dust, mite, all these factors are responsible in triggering urticaria. Then infections like upper respiratory tract infections, especially viral infections, COVID vaccination, then parasitic infections, urinary tract infections. These infections can also trigger urticaria. There are certain physical stimuli as well, like heat, cold, pressure, vibration, or solar exposure, sun exposure, basically. So these can also trigger urticaria.
So we can in short say that, a lot of things, n number of things can actually trigger or cause urticaria. Now the thing is, it's a medical condition, but how serious can it be? I mean, is it a life-threatening medical condition, or it's just you will get, rashes and it will itch, that's it?
So urticaria is basically an allergic reaction. That means that it happens in response to some allergen. However, in some cases, it could be a sign of underlying serious internal disease as well, like some infections, some rheumatological conditions, or autoimmune disorders, or vasculitis. So we definitely do need to look for the signs and symptoms of such underlying etiology. But where if I talk about it's life threatening, then in most of the cases it is not like it's very simple and it is not serious. Okay, in few cases only it can present with the signs or symptoms of angioedema, which is basically swelling in the deeper layers of the skin. So you present with swelling in your lips, in your eyes, your hands, your feet, your genitals. Sometimes, it can present with the swelling in your airways also, where you present with the signs and symptoms of like difficulty in breathing, difficulty in swallowing. So definitely in all cases of urticaria, however, most of the cases are very simple and they do not need to be to fear about anything, but definitely we need to explain them these danger signs, that they need to rush to the hospital emergency if they encounter any symptoms like difficulty in breathing, difficulty in swallowing, pain abdomen, nausea, vomiting, or lightheadedness, or loss of consciousness.
Right.
These are
So
very,
in
very
general,
rare.
in most,
These are very,
right.
very rare. Most of the cases do not present with any complication.
Okay, so in most of the cases, it's not life-threatening, but it's important to understand what it is. It's important to be aware of it so that we know that, if it occurs, we need to go and consult the doctor. So viewers, please इस बात का ध्यान रखें, अगर urticaria है, जो symptoms डॉक्टर ने बताए वो हो रहे हैं, तो उन्हें ignore मत कीजिए, neglect मत कीजिए, do consult a skin specialist. आपकी जो quality of life hamper हो रही है, वो भी बचेगी. आप बार बार इच नहीं करते रहोगे, एंड प्लस अगर वो सीरियस कॉम्प्लिकेशंस भी कुछ हो सकते होंगे तो वो भी रूल आउट हो सकता है, हो जाएगा. प्लीज कंसल्ट योर डॉक्टर विदाउट वेस्टिंग टाइम. Now doctor, one more thing I would like to understand. We often say that there are two kind of urticarias, acute and chronic. तो इनको हम किस तरह से समझ सकते हैं?
So urticaria दो टाइप्स के होते हैं बेसिकली, acute urticaria and chronic urticaria. Acute urticaria में symptoms जो है वो less than 6 weeks के होते हैं. जब उनका urticaria lasts for more than 6 weeks, that is when we call it a chronic urticaria.
Okay, so the bifurcation is very simple. But then in case of an chronic urticaria, what's the treatment like, as well as in the case of acute urticaria? And plus chronic urticaria के case में क्या वो completely ठीक हो सकता है? Because many times people say that I have chronic urticaria, but the treatment is just going on and on and on, and we don't know when will it wrap up. So
chronic urticaria, it is very unpredictable. Whom it affects, when it starts, and when it's going to end, we do not know. With treatment options, we can definitely control the symptoms of urticaria, we can control the disease, but we cannot cure it because there is always a chance of recurrence. It can reappear after a few months or few years, there is always a chance of recurrence. So definitely we cannot say that there is a cure to urticaria, but with medicines we can definitely control it.
And in case of acute urticaria, how easy it is to treat?
See, in acute urticaria, the treatment is usually symptomatic with anti-allergics, non-sedating anti-allergics. Most of the cases respond to that itself. And since acute urticaria resolve on its own, so we really do not need to worry about that.
And doctor, are there any potential complications of urticaria if left untreated?
If left untreated, then as I talked about previously, few cases of urticaria can present with angioedema, which I said that it is a swelling of deeper layers of the skin. So in very rare cases, it can also present with the signs and symptoms of anaphylaxis. So I talked about all the danger signs. We need to look for those danger signs and immediately contact our doctor.
Exactly.
Apart from that, some complications, some minor complications like side effects of antihistamines like dry mouth, sedation, then poor quality of life, stress. Some patients even present with depression because of the urticaria. So these are some of the aspects that we can't overlook in cases of urticaria.
Right. And as you mentioned that some patients even go through depression, the thing is that I can, imagine how much discomfort or irritation or frustration a patient with the urticaria goes through, because he is continuously itching, those rashes, etc., and maybe just aloofing himself or herself from the whole society, not going to public functions or not socializing much, because it's a very awkward or embarrassing situation to keep on itching. Now the thing is, stress is also associated with the whole condition of urticaria. Now, does this stress also aggravate the already whatever the condition of urticaria a person is having? Is it going to aggravate that?
Yes. So stress is an important factor in contributing to urticaria. It can trigger urticaria or it can exacerbate urticaria. So when you are stressed out, there is increased release of histamines, certain inflammatory markers, which is responsible for the signs and symptoms of urticaria. So definitely stress triggers your urticaria. Your urticaria triggers stress. So it's a cycle basically.
It's a vicious cycle, and the only way to stop or break that cycle is to go and consult a doctor and get relief. Doctor, as you said that it's an allergic reaction. Now, the thing is that in India, over-the-counter medication is so easy. You just go ask a chemist, see, I'm having these allergies, please give me an anti-allergen. People know even the name, etc. So, is it good or is it dangerous? How much harmful it can be? So please enlighten us on that.
So if there are mild symptoms or if it has happened just once or twice, you can think of taking an anti-allergic medicines, which we all know basically. But if your symptoms are chronic and if the severity is there, then we definitely need to see our doctor just to see if it is urticaria or not, if it is at all urticaria. And if it is urticaria, then what are the underlying causes of that urticaria? We need to find the underlying etiology so that we can treat it effectively.
Exactly. तो सही से उसका इलाज हो सके, इसलिए बहुत जरूरी है कि हम उसकी जड़ तक, वो किस वजह से हो रहा है, उस तक पहुंचे, और कॉज को डायग्नोस करने के लिए बहुत जरूरी है कि हम डॉक्टर के पास जाएं, तभी वो सही से डायग्नोस हो सकता है. डॉक्टर, वन मोर थिंग, एक और बहुत आम चीज हमारे सोसाइटी में है कि मेरे किसी दोस्त को या किसी परिचित को हुआ, उसने कोई ट्रीटमेंट किया, फिर जब मुझे हुआ तो आई शेयर द प्रॉब्लम विद हिम और हर, और उनका प्रेस्क्रिप्शन मैं लेके चली जाऊंगी, ओवर द काउंटर मेडिसिन ले लूंगी और उससे मैं खुद को ट्रीट करना शुरू कर दूंगी, या फिर ऑनलाइन सर्फिंग इज देयर. It's so easy these days. Lekin we restrict ourselves. I don't know for what reason, but we restrict ourselves from going to the doctor and will waste our time, energy, money, etc. on self-medication or over-the-counter medication. So exactly जब हम अपने दोस्तों से या परिचित से या रिश्तेदारों से प्रेस्क्रिप्शन लेकर वही इलाज, क्योंकि हमको भी तो वही हुआ है, तो ये कितना डेंजरस हो सकता है?
अर्टिकेरिया साइन को देखें, ठीक है, हम एंटी एलर्जिक को ठीक कर सकते हैं, बट जैसे दो लोग सेम नहीं हो सकते, ऐसी उनकी प्रॉब्लम भी सेम नहीं हो सकती. The most important is to find out the underlying etiology की प्रॉब्लम किस वजह से है. जब तक उसको हम ठीक नहीं करेंगे, हम अर्टिकेरिया को नहीं ठीक कर सकते. We need to see doctor just to give a right direction to the treatment of this urticaria. ताकि प्रॉपर उसके जड़ तक हम पहुंच सके कि किस वजह से उनको अर्टिकेरिया हो रहा है, एंड देन उसको एलिमिनेट करना एंड राइट ट्रीटमेंट देना. सो दैट डायरेक्शन इज वेरी इंपॉर्टेंट.
I completely get your point. और डॉक्टर, जिस तरह से आपने बोला कि acute urticaria होता है और फिर chronic होता है, तो ऐसे में अगर हमारा acute urticaria का स्टेज है और तभी अगर हम डॉक्टर से जाके मिले, तो क्या ये पॉसिबल है कि बहुत आसानी से हमारा इलाज हो जाएगा, और बजाय इसके कि हम सेल्फ मेडिकेशन या ओवर द काउंटर मेडिकेशन में अपना समय जाया करें और वो chronic में कन्वर्ट हो जाए, क्या ऐसा भी होता है?
एक्यूट अर्टिकेरिया का अगर डिटेल्ड हिस्ट्री से हम उसके रीजन तक पहुंच पाते हैं कि किस वजह से अर्टिकेरिया, देन इट इज़ वेरी सिंपल टू ट्रीट अर्टिकेरिया. And with right medications given in right dose, it is definitely it is most of the cases of acute urticaria, they resolve with treatment or on its own. Okay, chronic urticaria may we definitely need to run some investigations to treat them as per the protocol, ताकि हम उसको ठीक कर सकें.
Right. And many patients complain that their hives or urticaria get worse during night. Why that happens?
If their symptoms are getting worse during the bedtime, that then probably it means that they came in contact with the allergen during their bed routine. Probably the food that they ate in their dinner, or any medication that they took just before bed, or the bed linens or the fabric of the clothes that they wear, like night suit. So these factors can trigger urticaria or exacerbate urticaria during the night time. And sometimes there is just perceived exacerbation of their symptoms, because during the daytime we are busy in our daily routine, and we don't think about our these urticarial rashes, itching. But at night time, when our mind is empty, we think about our problems, we start thinking about these urticaria. So there is perceived that
Exactly.
increase in the
They have
itching.
all the time during the bedtime to think that, okay, I have these urticarial rashes and they are, getting worse, etc. But in the day, we are mostly preoccupied. So that can be one reason. And patients also complain that they feel very tired. They feel very fatigued because of their, urticarial rashes. Why that?
Yes, I do often hear that they feel tired, probably because of the poor sleep quality, because of their stress, that they feel tired and fatigued. Moreover, the sedation that is caused by their anti-allergics, antihistamines, that also adds on to that tiredness.
Right. And as you mentioned that, urticaria can be because of a number of things, allergies, and one is definitely the, food items we are consuming or intaking. So we may be allergic to those like nuts, seafoods, eggs. These are very common, people normally have allergies to these. Now, are there any dietary precautions or do's and don'ts for patients of urticaria?
Yes, there are. So as I said, there are certain food items that can trigger urticaria. And sometimes when urticaria is not because of the food items, even if it is because of some other etiology, then there are certain food items that are known to exacerbate the symptoms of urticaria. So we definitely need to avoid these food items like seafood, eggs, milk, berries, chocolates, foods with preservatives, additives. All these things we should avoid.
Okay.
Nuts,
And
peanuts.
yes. Yeah, with nuts as well. Are children equally prone to urticaria? Because again, children are very allergic, especially to food items like nuts, fish, eggs at times. So are they equally prone to urticaria?
Equally, yes, equally.
Okay. And many times, because with skin allergies specifically, we have this notion in our head that it is contagious and I'll get it from other. उससे मुझे हो जाएगा, उसको छूने से मुझे हो जाएगा. ऐसा एक बहुत दिमाग में हमारे रहता है. तो urticaria के साथ what's the thing? I mean, is it contagious?
So urticaria is not contagious. No matter what the etiology is, it cannot spread from one person to another person, period.
Okay, right. So please, clear your heads. Be very clear about it. Urticaria is not at all contagious. तो किसी को भी छूने से, किसी भी urticarial patient को छूने से आपको urticaria नहीं होने वाला है. तो जरूरत है कि आप उसे डॉक्टर के पास ले जाएं, उनका सही ट्रीटमेंट कराएं, ये ज्यादा जरूरी है. डॉक्टर, पिछले 2-2.5 साल का जो समय था, जिसे हम कोविड एरा कहते हैं, अभी भी खत्म नहीं हुआ है. So we should be, अवेयर ऑफ इट और उसको लेके हमें सावधानी भी बरतनी चाहिए. लेकिन पिछले 2-2.5 साल में कई पेशेंट्स आए, उन्होंने कहा कि उन्हें कोविड के साथ साथ हाइव्स हुए फेस पे, या फिर हाइव्स हुए एंड बाद में जब उन्होंने चेकअप कराया तो पता चला दे आर कोविड पॉजिटिव. तो ये क्या कोरिलेशन है कोविड का और हाइव्स का, अर्टिकेरिया का?
There is a huge correlation ever since that COVID has happened. We have seen a huge surge in the cases of urticaria. Like I said, urticaria can happen with any viral upper respiratory tract infection, COVID included. So even the vaccinations that we are taking for COVID, even that can trigger urticaria. So once you've contracted the infection of COVID, urticarial rash can happen before your COVID symptoms or during your COVID symptoms or even after you develop your COVID symptoms.
Right. But that's not too dangerous, or even you mentioned vaccination के बाद भी कुछ लोगों को urticaria हुए, तो it's common. I mean, it's treatable, right?
Yes, it's treatable. Once you are out of that infection, so these symptoms, they subside.
ओके. अच्छा, जब ट्रीटमेंट के लिए कोई आता है अर्टिकेरिया के, तो किस तरह से ट्रीटमेंट होता है? पहले क्या कोई लैब टेस्ट होते हैं, या फिर सिर्फ इन्वेस्टिगेशन, हिस्ट्री इन्वेस्टिगेशन से ही आप लोग ट्रीटमेंट का लाइन जो है वो भी डिसाइड कर पाते हो?
So acute urticarias में हम usually कोई investigations नहीं करवाते because ये cases अपने आप ही resolve हो जाते हैं. जो cases chronic urticaria की category में enter हो जाते हैं, then we need to run some laboratory investigations to rule out the underlying etiology. For example, differential counts, ESR, C-reactive protein, infections को rule out करने के लिए. Then urine routine microscopy to rule out urine infections, stool test for ova and cyst to rule out any parasitic infestation, then thyroid abnormalities को rule out करने के लिए thyroid investigations की जाती हैं. And in cases where we see the signs and symptoms of underlying etiologies like rheumatological problem or autoimmune disorders, then certain lab investigations are done to rule out that as well.
अच्छा, मैं एक सवाल ये भी जानना चाहूंगी कि जैसा कि आपने बताया एलर्जीज की वजह से भी अर्टिकेरिया होते हैं. एलर्जी की वजह से एक बहुत बड़ी वजह एलर्जीज हो सकती हैं. ऐसे में चूंकि आजकल एलर्जी टेस्ट भी होते हैं, पीपल आर अवेयर ऑफ इट. नाउ देयर आर टाइम्स जब वो लोग डॉक्टर के पास जाने से पहले लैब्स पहुंच जाते हैं और अपना एलर्जी टेस्ट कराते हैं, एंड दे कम टू नो कि उन्हें 30 फूड आइटम्स से मे बी दे आर एलर्जिक टू. So how rational is that? How rational is to go and do a self examination or serum test or allergy test? How I mean, is it going to do any good, or पहले डॉक्टर के पास जाना चाहिए?
So if see, I don't have any signs of urticaria, but even if I go and get myself tested for these allergies, then I'll come positive for many things.
Right.
So okay, you get these investigations done and you get to know about the possible allergens, but in reality when we talk about the treatment, बहुत ज़्यादा हेल्पफुल नहीं होते हैं ये इन्वेस्टिगेशंस. It is not possible to to get rid of all the allergens in your daily routine. Food items, okay, you can still avoid eating those items, but then there are certain allergens in the environment which are primarily responsible for your allergy. And food items, so it's just an accidental finding.
Exactly. And it's just not the allergy from food. You may be allergic to certain medication. You may be allergic to, what you are inhaling. Pollens, etc. can also cause the allergy. प्लस इन्फेक्शन की वजह से भी अर्टिकेरिया हो सकता है। तो इतने सारे कॉजेज है और कई बार कॉजेज पता भी नहीं चलते हैं। तो इसलिए बहुत जरूरी है, जो हम बार बार कह रहे हैं, ये पूरा सेशन कंडक्ट करने का भी यही ऑब्जेक्टिव है कि हम आपको अवेयर कर सके कि अर्टिकेरिया क्या है, कैसे हो सकता है, कैसा होता है और उसका ट्रीटमेंट ऑप्शन क्या है। सो प्लीज गो एंड कंसल्ट योर डॉक्टर इफ यू हैव दीज सिम्टम्स। कुछ सवाल भी हम अपने व्यूअर्स के लिए ले रहे हैं। साक्षी सोनी है, पूछ रही हैं, कैन अर्टिकेरिया अफेक्ट माय ऑर्गन्स?
Urticarias will not affect your organs except for if there is angioedema associated with it, or if there is any underlying etiology. See, urticaria is just a symptom that is happening. The underlying etiology is important. Agar aapko koi internal disease hai, then that disease itself can affect your organs, but urticaria ki wajah se koi organ affect nahi hota.
ओके। आरती मीना पूछ रही है, व्हेन इज अर्टिकेरिया considered an emergency? Though we have also already spoken about it, but still, if you would like to shed some light on it.
When your allergic reaction, it involves your airways. So when you start noticing that there is difficulty in breathing, difficulty in swallowing, or when there is swelling in your tongue, or when you feel nauseous or vomit, you vomit, or there is pain abdomen, or you feel lightheadedness, or there is loss of consciousness, that is when you should, just rush to the hospital.
Right. Tripti Saluja, I think on the same line, उनका question है, मैम क्या अर्टिकेरिया dangerous है?
In most of the cases, urticaria is not dangerous. Very, very rarely, urticaria can present with these life-threatening problems that I just shared. So it is very rare, but it is important that you should be aware of all the possible danger signs or complications of urticaria, so that you can just take that step immediately.
Exactly. तो तृप्ति, most of the cases, जैसा डॉक्टर बार बार बता रहे हैं कि most of the cases में वो dangerous नहीं होता, लेकिन anyways जो symptoms है अर्टिकेरिया के, वो बहुत आपकी quality of life को तो hamper कर ही रहे हैं। आप पूरी time itch कर रहे हो सकता है आप socialize नहीं कर रहे हो, public functions में जाने से avoid कर रहे हो, because आपको पता है कि बहुत ही एक awkward situation हो जाती है। तो इसीलिए इसको ignore करना या neglect करना नहीं चाहिए, ताकि एक तो आपकी क्वालिटी ऑफ लाइफ हैम्पर हो रही है, तो उससे आपको रिलीफ मिल जाएगा। इट्स ट्रीटेबल, इट्स क्योरेबल। तो प्लीज गो एंड कंसल्ट योर डॉक्टर। और फिर अगर आप डॉक्टर से पहले ही मिल लोगे, तो हो सकता है कि आपकी उतने डेंजरस सिचुएशन तक, उस स्टेज तक पहुंचने की अर्टिकेरिया की नौबत ही ना आए। इसलिए बहुत जरूरी है कि हम डॉक्टर से मिले। शिवा यादव अगेन ऑन द सेम लाइन, क्योंकि इसको भी हम लगातार डिस्कस कर रहे हैं। कैन आई यूज ओवर द काउंटर मेडिकेशन और डू आई नीड प्रिस्क्रिप्शन ड्रग्स?
So definitely you should meet your dermatologist so that a proper detailed history can be taken, and a probable cause of your urticaria can be found out, so that triggering element can be eliminated.
एग्जैक्टली। और जैसा अभी डॉक्टर ने कहा भी था ना कि एंटी एलर्जेंस जब आप लेते हो तो हो सकता है थोड़ा सेडेशन हो, आपको नींद आए। मान लीजिए आपका प्रोफेशन, आप एक ड्राइवर हैं या यू आर ऑलवेज ऑन दी गो, और या पायलट हैं, खैर उस केस में तो फिर आपके डेली जो है चेकअप्स होते हैं, बट स्टिल आप मान लीजिए एक ड्राइवर ने अगर सेडेटिव ले लिए खुद से, उनको पता ही नहीं है कि इसका क्या साइड इफेक्ट्स हो सकते हैं, तो वो उस तरह से लाइफ थ्रेटनिंग हो सकता है। तो इसलिए जो भी दवाएं लें वो डॉक्टर के प्रिस्क्रिप्शन पर ही ले, ये बहुत जरूरी है। और प्रिस्क्रिप्शन आपका ही होना चाहिए, आपके डॉक्टर का आपको दिया हुआ, ऐसा नहीं कि आप किसी और को जो सेम प्रॉब्लम थी वो वाला प्रिस्क्रिप्शन लेकर जाए, तो वो गलती।
Moreover, to assess the severity of urticaria, आपके urticaria severity के according ही आपकी medicines choose की जाती हैं, उसकी dosing भी उसी के according choose की जाती हैं। So एक इंसान के लिए जो काम करता है वो जरूरी नहीं है वो दूसरे इंसान के लिए भी work करे। So it is important that आप अपने dermatologist से मिलिए, so that आपके लिए proper medicine suggest की जाए।
एग्जैक्टली तो ऑनलाइन सर्व करने से भी बचे, क्योंकि अगेन वो एक जनरल होता है, सबके लिए होता है, ऑथेंटिकेटेड भी नहीं होता। तो उसमें आप जितना वक्त जाया कर रहे हो ओवर द काउंटर या केमिस्ट से बात करके या किसी परिचित से बात करके जिसको अर्टिकेरिया हुआ था पहले, ये सब टाइम इधर उधर ना वेस्ट करके अगर आप ऑनलाइन सर्व करना चाहते हैं तो अपने आसपास एक अच्छे डर्मेटोलॉजिस्ट का पता ढूंढिए, वहां जाइए, या अगर आप फरीदाबाद में है तो आप डॉक्टर संचिता गुप्ता से कांटेक्ट कर सकते हैं। प्रियंका राजपूत पूछ रही हैं, व्हाट अंडरलाइंग कंडीशंस मे कॉज अर्टिकेरिया?
So underlying conditions like infections, upper respiratory tract infections or tooth infection, parasitic infections or urinary tract infections can trigger urticaria. Apart from that, autoimmune disorders like SLE, uh, dermatomyositis, these autoimmune disorders can trigger urticaria. Apart from that, vasculitis. So these are, and some rheumatological conditions, rheumatoid arthritis, all these underlying internal diseases basically can trigger urticaria.
Fair enough. We have Sri Sharma asking, why do I have hives that don't itch?
So if that is happening, then you are blessed actually. What better than that? But most of the cases, they actually present with itching. Yeah. So if there is no itching, then probably the inflammatory markers, are not very, they're not very active in that case.
Okay, okay. And doctor, many times happen because in chronic urticaria, ट्रीटमेंट जैसा आपने भी बताया कई बार बहुत लंबा चलता है क्योंकि कॉज डायग्नोस नहीं हो पाता। ऐसे में पेशेंट जो है वो ट्रीटमेंट लेना शुरू करता है, फिर उसे लगता है कि अच्छा अब आराम मिल गया है, तो वो खुद से ही ट्रीटमेंट बंद कर देते हैं बिना अपनी डॉक्टर से सलाह लिए हुए। फिर थोड़े समय बाद फिर वो उनको कॉम्प्लिकेशंस होते हैं, फिर उनको लगता है अच्छा वो प्रिस्क्रिप्शन तो रखा हुआ है, दे विल जस्ट टेक आउट द प्रिस्क्रिप्शन, गो गेट द मेडिसिन्स एंड स्टार्ट ट्रीटिंग देमसेल्व्स अगेन। क्या ऐसा करना ठीक है, या जो ट्रीटमेंट का कोर्स है क्रॉनिक अर्टिकेरिया में उसे कंप्लीट करना जरूरी है?
There is no course of treatment actually, because we don't know that when it is going to end. So हम इवन ट्रीटमेंट को के कोर्स को भी डिफाइन नहीं कर सकते कि ट्रीटमेंट कब तक चलेगा. But usually it is suggested that anti-allergics should be taken on regular basis rather than taking on SOS basis कि जब आपको symptoms आए आपने anti-allergics ले लिए. Because to understand that we need to understand the pathology at ऑल्सो अर्टिकेरिया होता है जब हिस्टामिन रिलीज होता है. ये मेडिसिन जो हम लेते हैं इनका काम होता है कि उस हिस्टामिन को ही रिलीज ना करवाए. वंस द हिस्टामिन इज रिलीज्ड सिम्टम्स होंगे ही होंगे. सो हमें जो मेडिसिन लेनी है दैट इज टू ब्लॉक दोज हिस्टामिन रिसेप्टर्स ताकि हिस्टामिन ही रिलीज ना हो और आगे हम फर्दर एपिसोड्स हम कंट्रोल कर सकें.
राइट, सो आई थिंक इम्पोर्टेंट बातें ये हैं कि एक तो ये जब हमें सिम्टम्स हों तो हम इग्नोर ना करें, डॉक्टर को दिखाएं, दूसरा अपने डॉक्टर पे ट्रस्ट करें. So don't waste your time and just, suffering in silence or doing over the counter medication or self medication. Go and consult your doctor. Trust your doctor. That's really important. Doctor, as we are, moving towards the conclusion part of this session, any takeaway message for our viewers?
So, takeaway message is basically if you have urticaria, do not stress about it. Do not take any stress about it. Go meet your dermatologist so that a proper direction can be given to your treatment. A detailed history is very important to find out the cause and to eliminate that triggering factor. Half of the job is done there itself. And if you're, if you still have urticaria and if it is chronic, then a proper, it needs to be treated through a proper treatment protocol. So go meet your dermatologist, know about the danger signs so that you can take the right action at right time. That's all.
Right. So don't ignore your symptoms. Don't suffer. It's treatable. So please go and contact your doctor and get early relief. Thank you so very much, Dr. Sanchita Gupta. It was lovely talking to you. And thank you for taking out your valuable time for this session.
Thank you so much. Thank you so much. It was a very good session and you hosted it very well. And it was very
It was a pleasure to have you with us. Definitely, it has been a very informative session for our viewers, and I'm sure they will use this information to prevent themselves and their, near and dear ones from getting urticaria. And in case if they get to see such symptoms, they will now at least go and approach a nearby dermatologist rather than doing self-medication. Thank you so very much. We really look forward for many more such sessions in coming times with you for our viewers.
Thank you.
And viewers, thank you for your active participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our FB page, all about skin allergy. We are also available on YouTube, Twitter, and Instagram. Thank you. Goodbye. Have a great day ahead. Bye.